Well, welcome to another webinar hosted by Thrive West Central on the Resilience study. This webinar's focus is on the healthcare pillar in the Resilience study. Today, we're joined by Terry Warren, CEO of Valley Professionals Community Healthcare, and Hicham Rahmouni, Executive Director of the Richard G. Lugar Center for Rural Health, a division of Union Hospital. Welcome.
Thank you.
Thank you.
Hicham, would you tell us a little bit about what the Lugar Center does here in Terre Haute?
Absolutely. Thank you for the opportunity to visit with you today. The Lugar Center for Rural Health is named after the late Senator Lugar, and our mission is to advance rural health through education, through innovation, and collaboration. So over the last 30 years, our focus has been on bridging gaps, be it access gaps, be it training physicians and providers across disciplines to be able to practice and support our rural communities, be it technology, telehealth, other innovations that can help make and keep our populations healthy and well.
Well, great. Terry, tell us a little bit about Valley Professionals Community Center.
Yeah, thank you. So we've been part of Wabash Valley now for over 14 years. Valley Professionals Community Health Center was originally named Vermilion Park Community Health Center. We kind of originated in the Vermilion and Park County area, but as we grew, we kind of looked at changing our names to be Valley Professionals. We're a federally qualified health center. We service over 25,000 patients in the Wabash Valley. And we kind of specialize in primary care, behavioral health, psychiatry, and then we also have chiropractic and dental. So kind of a full spectrum of care. And we also see patients regardless of ability to pay. So we see all payer sources.
And what communities in the Wabash Valley are you in?
Yeah, so we're in Vigo County, Vermilion, Park, and Montgomery County.
Okay, and you, I believe you just opened up a new facility in West Terre Haute. Want to congratulate you on that. I know you've been working hard for that.
Yes, thank you. We're super excited. Yeah, we actually have 3 sites now in Terre Haute area, and on the north side, west side, and south side of Terre Haute. And West Terre Haute's it's been kind of a big passion of ours to kind of get that open, and it's been a whole, I guess, community effort. So thank you so much.
Yeah, it's been great to watch the community come together and support you in your efforts there. It's really been phenomenal to watch. Well, as you both know, we at West Central, we spent 2 years doing a study on the impacts of COVID. And really one of the top line issues that have come out of the study is mental health. You know, COVID highlighted the lack of mental health professionals, what organizations are doing to address mental health has really come top of mind. What are you seeing in the healthcare community being done to help with mental health in our region? Terry, you want to answer that first?
Sure. Yeah, sure. Yeah, so absolutely. I think when you look at your plan, you guys went pretty good in depth over what issues that we're seeing in the community, and what we have seen is no different than what your study has shown. It's been very difficult the past couple of years to get through that. But what we've been trying to do is just trying to hunker down and trying to focus on getting that care to the patients the best we can. Some of the struggles we've seen, though, is actually having enough help and having staffing. We have over 45 people on our staff that help with either psychiatry or mental health, case managers, and we have a long wait list. As of right now, we have over 500 people on our wait list throughout, through Montgomery County all the way down to Vigo County, of people who are seeking care. So trying to get that turnover has been challenging. And we did not have those numbers prior to COVID. So that's what you can see the impacts. What I'm excited about the community, though, is that I feel like there's a lot of folks in the community who are trying to tackle this. It's not just Valley Professionals. It is Union Hospital, Valley Professionals, there's a multitude of folks throughout the community who are trying to tackle it. And then we all know there's issues, and trying to think outside the box and what we can do to get people in quicker than normal. So.
Great. Hicham, thoughts?
Absolutely. The last couple of years, as noted, have been tremendously difficult on many fronts, on us as individuals, on us as employees, as employers, but also as caregivers. And providing care for our community across conditions has been such a challenge. And the one addition that I'll offer is that of supporting our providers. There's been tremendous burnout, and we've seen it across industries, but it's been absolutely keen within healthcare because the workforce shortages have become a reality over several months now. And the difficulty of the environment where the longer shifts, the difficulty caring for patients who have gotten sicker for different reasons has taken its toll. And that's where the mental health side for providers, for clinicians, as well as the community has been very astute. We've been fortunate in collaborations with many of the organizations that TJ cited to provide that support for employees, for healthcare providers. And we're seeing that across other organizations in the Valley. There's more and more of an acceptance, and fortunately it took a pandemic to get there, of the need for whole health, the individual, both the body and mind. There are definitely gaps around we do not have enough providers, but I trust this effort and others is bringing that awareness to provide that preventative side of things, not just waiting till somebody's diagnosed with a mental health disease, but looking at behavioral health. What are coping mechanisms? How do I take care of myself so that it doesn't become difficult and become a more serious condition, just like we do with any other disease?
So what can we as a community do to help with that talent attraction and retention? Because it just not in the healthcare industry, but we're seeing in a number of industries, we're all struggling for people. But what specifically can the community do to help you all attract more talent to your organizations?
That's a great question. I think we already have great academics in the Wabash Valley that do a fantastic job of keeping or training these, the providers that we need. And I think we've seen a lot of them stay in the community. So I think we're doing a fairly good job of that right now. I think what we need now is just we need more people actually that are interested in getting into mental health or to just start signing up and actually being or thinking about that avenue. We've actually had students come out and rotate through our clinics. They've been interns. They want to see what they want to do. We've actually had some students who thought they wanted to be a physician, and after rotating with our clinics, they decide they want to go into psychology or mental health. So I think we're seeing some of that. I think we just need to keep opening our clinics up or our other institutions up to allow some of those students who need, especially the high schoolers who are just not sure exactly what they want to do. They know they want to be in healthcare, but they're just not sure what healthcare sector they want to be in. Maybe opening that up and kind of showing them what the need is. I think that's probably one of the solutions. I'm sure Hicham has a couple other thoughts too.
Well, Sean, let me ask you, you're part of a group that brings in residents for rural healthcare. How important is that program to our region?
It's been tremendous. It's been tremendous because I remember this conversation happening years ago, and I've learned from my predecessors that 30 years ago, we had these exact same issue with physicians. Do we have enough doctors, not only in Terre Haute, but in Clay County, in Park County, in Sullivan County Green, the West Central Indiana as a whole? So that's a model, that's a blueprint that is anchored on collaboration. It's anchored on partnership between universities, between industry, between community leaders, as well as healthcare partners. And I believe, so the Lugar Center serves as an innovation center for healthcare, for rural health in particular. And this has been a conversation that that's been top of mind. How do we create that pipeline? How do we create those pathways for somebody, as TJ noted, through high school to have that awareness in terms of build a very strong career caring for their community, caring for their neighbors, family members, and so forth, as well as create the opportunity for somebody from another industry to acquire the skills to be able to practice in a clinical setting. It does not have to be a doctor, it does not have to be a nurse. There are dozens and dozens of professions, and that's where the partnerships with the institutions of higher learning, and we've been thinking through, can we create these intermediary majors or experiences, and having organizations like Valley Professionals who embrace those educational opportunities where you have to have the hands-on learning to be able to reinforce the skills in the classroom and then be able to practice and be able to be ready for service, to be job ready, so to speak, as a priority across other industries, and has been an emphasis for the chambers and others in our community. So that's the part where we're learning from other industries. We're applying the models that have existed, that have worked locally. And again, the key, I cannot emphasize this enough, it takes all of us. It's those partnerships. You may not think it's a natural fit, but it truly takes the community leader, the civic leader, maybe help with interviews, maybe provide that mentorship or coaching and so forth, as well as our clinical experts sharing that knowledge.
Yeah, that's great. That kind of brings, to my mind, I think, Terry, you're a co-chair of a community plan focused on healthcare. One of the pillars in that plan through the chamber is on healthcare. How has that community plan been going?
The community plan's been going very well. It slowed us down a little bit with the pandemic, but we still were able to meet on a very regular basis. And it's really been exciting to see the community plan come together. We've been reaching out, and within the community plan, mental health has also became one of the top areas of our sector, and not just mental health, substance abuse, which again both are on your resilient plan with healthcare. We've also been discussing staffing, but I say as a group, the Wabash Valley has a very committed group of individuals who come together. They meet every single month, and I'm just proud to kind of see where things are going. It's just been really neat, and we're working on a few other things now. And again, I think we're really starting to make some progress. I'm really proud of the chamber and kind of keeping us going.
Yeah, I think it's great to see that collaboration amongst industries and healthcare kind of coming together, because that's what it's going to take to solve some of these issues. But moving on, one of the other things in our study that really jumped out at us was during COVID, the use of telehealth. We saw, a huge uptick in telehealth services during COVID. Now we've weathered the COVID issues for the most part, but hopefully. But how do we keep telehealth in the mix moving forward? I'm assuming this hopefully will continue to be a best practice, especially to help those in rural healthcare. But what do you think is holding us back, aside from broadband, which we're dealing with? But what is holding us back from using telehealth more in our communities?
I think in the rural areas, it's acceptance, trying to make sure that telehealth is still, it is an accepted and reasonable form of care. I do know we are seeing more on those patients actually being more accepting of it. They've been asking for it. We still have patients who used it during the pandemic who still want to use it today. And we are trying to still build that into our schedule. And our ultimate plan is to develop kind of a hybrid model where we have in-person and telehealth type of medicine. Because some patients who are just, doing a med refill, checkup, we can do those online, doing on a telehealth type setting very easily. And that really kind of helps everybody kind of be a little bit more streamlined and help, being productive. So that's our hope. But I still think we need acceptance from the broader patient base. I do also know that based off of because we had, for mental health, we went completely telehealth during the pandemic. And that's one of the areas I think have been very well received over the past 2 or 3 years. Again, we want to see how we can incorporate that into our setting, because with mental health, you do also have a lot of no-show opportunities that come in, and this is a way that there isn't a way for the patient to no-show. If they're not able to get out that today, or if the weather is not good, we can telehealth them into a setting, and that could have helped maybe resolve a bigger issue that could have been forming. So that's what I think it really comes down to, is acceptance, other than the broadband issue that in rural areas. But we know that that's being worked on. Now it's acceptance of it and making sure that from the advocacy standpoint that it's a reimbursable area too.
Yeah, good point. Hicham, I know you guys are doing some unique things in the telehealth area.
We've been fortunate in terms of live telehealth. So where we have a physician or specialist in an urban center and a patient in a rural community. For the last 10 years, I think I'm referring to the Wabash Valley Rural Telehealth Network, and looking at some of the usage statistics. It started, I think, in 2012 with 90 patients, and then 17, 18, it was 5, 6, 7,000 consults per year. So this is connecting all the hospitals, clinics, community mental health centers in the region, and had a footprint around 14 counties. And it's been a simple model that was replicated. When we get to 2020, 2021, we go from those 6,000 consults to 25, 30,000 consults. This is strictly rural communities, which was phenomenal. So there is significant use within our region of telehealth. Having said that, telehealth is not a silver bullet. It's not a solution that fixes everything. It's a tool. It's a tool that relies on integration within practices. We talk often about the continuum of care in healthcare, where it's not just I show up, I drop off from another state, and I just start providing services. That can work, but that's not the most effective. Having those linkages with the local providers that care maybe for the cold, that care for the other condition in addition to mental health that you just cited, or any other conditions, whether it's cardiology or neurology or what have you. So there are opportunities there around having better linkages for it to become more mainstream. So we are using a technology that facilitates a telehealth encounter. You could be my doctor and I could be talking to you right now. There are other tools that can provide a monitoring throughout the day, or when we're not meeting, when we're not having the appointment. So those remote patient technologies, they're part of telehealth, but if I have a cardiac condition and my heart beats too fast, if you're my doctor and you ask me how it's been, I may tell you how I'm feeling right now, but it's very much useful for you to know how the last week in its entirety has gone, whether it's through a watch or whether through any additional support. Connecting those tools to what the practice does helps the providers be proactive. If they see something before my feeling really bad, only thing to go to the emergency department, you can act upon it. That's where the excitement comes in, and that's part of where there may be some opportunities logistically to connect all of these. I need my family physician at Valley Professionals, for example, to be able to see the whole picture so that I don't need to get sick. I don't need, for example, my car to break down to go to a mechanic. I can do the oil change, what have you, so that I'm always ahead of it. And that's the opportunity that telehealth creates, where we don't need a doctor or provider everywhere. We can bridge those gaps. It's huge for rural. You spoke of broadband. The other opportunity too is the penetration of smart technologies. I may have a regular phone. I may not have data plans on my smartphone to be able to do that 1, 2, 5-minute video that is necessary. So I think broadband is tremendous. The next side of it is coverage and affordability of telco plans and so forth. So I touched on a lot. So let me stop there. I'm happy to entertain any follow-up questions, but we've come so far, but we're also still have some ways to go. I'm really thankful for our clinical infrastructure. So all of our clinicians seeing the opportunity and building into the way they do business.
Yeah, and it does seem like the use of smart devices are playing a larger role in healthcare, at the home level. A neighbor of mine, I guess, has got some device that it's kind of on his finger and wrist. And I guess you all at Union are able to track how his health is on a daily basis through this device. And, it seems like more of that is going to come into play. What kind of things in the future do you think we'll see with smart devices that folks will be able to use at home that may be able to help with, such rural settings that we're in?
I can jump in, and I see it being endless, because right now, I mean, you can get scales, you can get everything, again, our watches that we wear on our wrist, it's doing EKGs for us now. It's linking that all up to our EMRs. I really do. I think it's endless. And when we are, and as Hicham has said, we've came a long way. And a lot of technologies have been released in the past couple of years. So it's hard to say where it can go.
Yeah.
I think our biggest challenge, though, for clinics is making sure that those devices will link up with our EMRs. That's going to be the next challenge. But I think it's something we're working on.
Yeah. Okay. Well, let's talk about transportation. I know, this is near and dear to all of our hearts, Thrive West Central does have a rural transportation program. But what we found in the study, that almost 7% of households within our region do not have a vehicle. Talk about the lack of transportation and really how that is affecting the quality of our healthcare here in the region. Hicham, you want to start us off?
It's a real issue. Its impacts are significant because those families that do not have reliable transportation, or 7% that do not have consistent transportation, and the percentages are higher the further you get away from Terre Haute or the larger urban settings. That means for me to access care, I need to take half a day off work. I need to borrow somebody's vehicle or ask somebody to take me. And then if there's a need to go to the pharmacy afterwards, or what have you, it just becomes more and more of a challenge. I'm thankful, truly thankful for the many organizations you cited, Thrive, Area 7 for Aging, CARS within the region that do help bridge these gaps. But the need is tenfold what it currently is. It gets in the way of somebody having a job, keeping a job. It gets in the way of somebody reaching or accessing foods to be able to eat or eat healthier, as well as accessing care. So it becomes this catch-22 and vicious cycle that transportation is a key. So the investments that are needed to break this vicious cycle will be felt throughout. That's my personal belief, and can't advocate enough for it.
Terry, I know you've spent a lot of time going in depth on the transportation issue here in our region. What your thoughts on transportation?
Yeah, I've done lots of work on that, trying to make sure, trying to see ways we can add on to it. In Vermilion County alone, it's people know that, a lot of people actually don't know, I guess, that the county itself is one of the longest counties in the state of Indiana, and so getting from point A to point B can be challenging. We have sites in Terre Haute, we have sites in Cayuga, Indiana, so we're talking 25, 30 minutes away, having some of their services. We have dental services there, we have chiropractic services there. So how can we get people there? So we've been looking at in depth over the years, trying how we can, develop a plan of action, and same with Park County, because we don't have any rural transportation. Other than working with Thrive, we don't have a transit in place to get people there. I think it's not just having the vehicle in place. I think now it's also the cost of transportation, with the fuel cost in place. Now that's what we're seeing. And I think, thankfully we have Thrive, and we have other resources to work with to get people there at our sites. I think that's also where telehealth can play a part. as we think of ways to actually get additional transportation resources into the community. Maybe telehealth is that bridge gap to get us there. But we've been doing, it's unbelievable the amount of, when we look at our patient no-show rates or cancellations, which is, I think as an organization, we're very low. We're only about 10 to 12%, but majority of those office visits are because they have no transportation. So how can we, work with that? And we educate them on other resources like Thrive. You can use those resources. We can give you gas cards, but it's still just having enough resources and infrastructure in place to get them to point A to point B. So we've constantly are looking at ways to improve it, but we know that's a dire need in this community.
Yeah. Do you think go ahead, Hicham. Did you have something to add?
If I may just build on the comments, there are resources that we haven't mentioned, like Medicaid avails cab services, but they're not as responsive to some of the immediate needs of beneficiaries, so Medicaid beneficiaries, which is the majority of the residents that are younger than 65 years old. The barriers of having to schedule something so far ahead, and then it's a window when somebody can come, are just not realistic and feasible. The other thing in terms of that we're starting to experiment with through some grant funding is, if somebody cannot come to care, how can we get the care closer to them, or even within their home, so to speak? If you reflect back to home visits that the doctors used to do years ago, so it's kind of history going full circle, is something that we're trialing and studying to determine how viable it would be in terms of connecting it as an outreach under certain circumstances. I think it ties the conversation of transportation. It can have multiple layers. It's not just for the general public, but it can take different forms of either taking somebody to or bringing care to, in terms of both ways.
Now, Hicham, that brings up a great point. Now, you're doing something kind of new in maternal health. And you got a grant from the state for that. Can you talk a little bit about that program and what you're doing there?
We have been fortunate through some safety pin state funding to be able to try to bridge gaps of access to care. We have, if you look at I-70 and the counties north of it, what is referred to as an OB desert. And it's an OB desert, so obstetrical desert. That means there's nowhere for residents to deliver. And what I mean by nowhere is your traditional hospital ward where somebody can deliver. The closest one, if somebody, and I'll use one of the Valley clinics in Bloomingdale to be able, that's Northern Park County, they either have to travel to Terre Haute, Plainfield, so Indianapolis, or Lafayette, Tippecanoe County. That's on average it'll be more than an hour. And if you've driven there, if you're not sure where it is, it's not very far from Turkey Run State Park. And there's no highway, there's no straight roads. And if the weather is an issue, it becomes a real barrier. So supporting women and families who are pregnant, who reside there, takes quite a bit. The health behaviors in our region, whether it's smoking, whether it's obesity, lack of exercise, and so forth, are near the bottom of where they are in terms of rankings compared to other counties in the state. So it's providing support services. It's that call a friend, whatever you need. How do you go from point A to point B? How do you access care? Who's your doctor? Who's your baby's doctor? And having somebody support that family from pregnancy until a child is a year old or 18 months old throughout that entire change. When I remember having my children, my wife and I were overwhelmed. It is to this day the most rewarding thing we've ever done, but it's still the hardest thing we've ever done. Which part? What do we do? What happens? Asking questions, accessing care are real issues. And as part of that too, we have wraparound services. So in terms of behavioral health, peer recovery support, or even nurse practitioners and a certified nurse midwife providing care closer to home in partnership with clinics like Valley Professionals or other sites, as well as within the patient's homes. So the All Babies initiative exists to help moms and babies have healthier pregnancies and celebrate their first birthday. And I'm mentioning the first birthday because it started as a result of our region having the worst infant mortality rates in the state. So babies who are born go home and unfortunately die before their first birthday for multitudes of reasons like safe sleep, etc.
Yeah, that's great. I mean, I think that's a good example of what Terry was talking about of healthcare going to the people and helping them become aware of what services are out there. Because I think one thing that I think we're seeing a lot of is there seems to be a lack of connectiveness, maybe, and communication between healthcare, the general public, and even sometimes I'll throw out elected officials. I often wonder if elected officials really understand the struggles of rural healthcare. And the transportation is probably a good example of that. I think a lot of locally elected officials don't realize the struggle, for you all with transportation, getting folks there. Any ways that come top of mind that we can improve that connectiveness between elected officials, the general public, and healthcare?
I think many of us have been trying for years. I think just getting them out to our communities to see and actually speaking maybe to some of our patients that we're speaking with. I mean, because I think we can talk all day about statistics and what we're seeing, but there are other life factors that come into play. And I think meeting with some of our patients and kind of letting them know, what they're seeing from day in and day out, I think is one solution. Because I know I constantly am asked, or why don't you use Lyft or Uber, and again, they don't realize that we just don't have those resources readily available in our community. I mean, I think Vigo County just, there are some now, but getting those rides available to come to, Vermilion and Park County is very challenging. So it's just, it's just going to take some time. But I just think education, making sure and letting them know what's out there, continue to collaborate. I think collaborating with our institutions, with the elected officials is probably key.
Yeah, great. Well, let's move on to aging. Our area, we have, a high level of folks over 65. That looks like that population is poised for some significant growth the next 5 years. How can we better support the aging community? What do you think we can do here in our community to better support the older population?
It's, in my opinion, there are several layers to it. A lot of the feedback, and we do track in terms of the data as a region, track ahead of the state. I also noticed from the Thrive Resiliency reports that we do not have gerontologists, the workforce that's prepared to care for the condition of somebody who is elderly, because the body changes, the behaviors changes, and the needs do as well. It's something that in preparing the workforce, we need to focus more on and be more intentional. There are significant gaps in terms of the social infrastructure, isolation. Think back to the beginning of the pandemic where we had to stay home. We couldn't connect. We couldn't go to work or visit, go to clubs or church or what have you. We felt it. We are social by nature as human beings. The elder one gets, a lot of the friends and family start dying, unfortunately. So having that social support is definitely in need, as well as recognizing that we touched on mental health, on substance use. The prevalence tends to be significant for elderly individuals, seniors, or patients in general. So recognizing that the environment where somebody lives, the ability of somebody to stay home and have the support and confidence to be able to eat and prosper at home reinforces that well-being, as well as the need to interact, and again touches on transportation, as well as that those social circles, and it can be a physical space in terms of placemaking, become really that more important.
And I would add too, and we've been trying to do a focus here, Valley Professionals, on patient experience. You know, what affects the younger folks, we need to think differently with the aging population. Their expectations are different than those of the younger generations. They expect just a higher level of care. I think they expect higher levels of respect, and I think we need to do that as caregivers. I think we also need to go back to what we said earlier, kind of going where they need us. So if they need us to do home visits, or if they need us to kind of walk them through things a little bit slower, we do it. I think it's just going to take a lot more. We have seen a huge growth in the Medicare population at Valley. We've gone pretty much from 12% Medicare population to over 20% Medicare population. So we've been kind of getting ready for that over the years, but it's going to continue to grow. We need to make sure we're ready for that. But just educating our staff, making sure that they have what we need for them.
Yeah, great. Well, we couldn't, do a study and really not see that substance abuse is playing a large role in healthcare in our community. I'd just throw that out to you two and your thoughts on substance abuse and what we can do to try to improve that here in our community.
Well, I think I'm very proud of Wabash Valley. I think we've done a really good job of getting a lot of partners. And when I look at the community plan and I look at what we've been doing on the chamber side of things, we have a lot of resources available. And in the past couple of years, we've had additional resources come into town. So I'm very proud of that. I think the collaboration that Wabash Valley has had in general, we have a strong group of people who are working to better provide services to those in the community. We need to, when patients are calling us to get in, and because they are suffering from some sort of substance abuse, we need to get them in as soon as possible. And I think that's what we've been trying to educate all our staff on, and we're trying to make availables. We actually have blocks in our schedule at Valley. So if we have a new patient who comes in or needs to be seen, we try to get them in as soon as possible. Ours is a little different in that they need to be a patient of ours, but we can put them in and make them a patient of ours if we need to. We try to be a little bit lenient, but we're not the only ones. There are a multitude of partners throughout the Wabash Valley that are trying to tackle this. So I'm just very proud when I look at that. That's one thing I've learned on this community plan and in general is we have a lot of people who are very passionate about getting tackling this issue.
I second everything that you just said, and shout out to you, TJ, and your team in terms of being part of the solution and providing support and resources in communities that didn't have them before in terms of treatment. I'd also like to recognize the work that the Chamber and United Way of Wabash Valley have done as conveners in terms of bringing together experts in the field, encourage them to collaborate. We can do a whole lot more together than in going at it solo or working in silos and trying to compete. And that's been really beneficial. We've come a long way for the last few years. We also have benchmarks and data to be able to measure progress on, because if we don't know where we're going, we'll never know when we get there. I also point out 2 or 3 key data points. So when we look at some of the assessments and surveys, starting as young as school-age children, where we see still significant use of tobacco products, vaping products, and so forth, they oftentimes can be correlated to use of marijuana, which are often recognized as gateway to other things. So anything from a standpoint of making those harder to access, be it costs, be it taxes or what have you, is a plus. There is a number that stood out to me, and I was not prepared for it, and this is personal ignorance on my end, is amongst high school seniors, the most often used substance, and we're talking 1 in 3 high school seniors, is alcohol. And that is that's a real issue, because when we look at the makeup of college prevalence, that's a common social substance. And if we recognize that 1 in 4, 1 in 5 individuals under normal circumstances is likely to become an abusive user of a substance. So there are mental health issues, behavioral health issues can lead somebody to self-medicate, but that's not everybody. There's a significant portion that just because of the makeup of their body are more likely to become addicted to any substance. So we have to be cognizant of the quote unquote legal substances also becoming an issue. So the prevalence of alcohol is real. That can lead to different complications, but it also becomes one substance no longer works. Do I seek another? So looking at the prevention, what can we do so that we're not having the same conversation in 5, 10 years is really important. I'm really encouraged by the path for the recovery and treatment we are, but also recognize that we need to spend more time around harm reduction in terms of what are activities that can be preventative. And a big part of it is where TJ started. We treat everybody the same. We don't think about you have this condition or other. You are a patient. So speaking of healthcare, we'll care for what you need regardless of what the condition and so forth. And whatever we can help you to stay and continue to be healthy is what we need to do.
Yeah, I would agree. I think, the one thing that I've seen that I am really proud of our community is we've really worked on stigma. And I think that's one of the keys, is that when someone is ready for help, we're here to help them. And, your organizations are here to help them. And I think that's a key in really dealing with substance abuse in the future. And I agree. I was a little startled by some of those numbers out of the survey on high school kids and substance use. The use of vape pens was a little surprising to me, but that was a good point to bring up. Well, in closing, I give you both an opportunity to give a close. Anything specific you wanted to say or talk about, happy to do so. Terry, why don't you start?
I just want to thank you and Thrive for putting this together. I think the plan itself is wonderful. I think it's a great asset. I hope everybody in our community does read it. I think it's a tremendous asset that we have to the community, and I just thank you guys for putting that on and actually putting this all together. I think it's much needed.
Well, thank you. Hicham?
I wholeheartedly agree. For us as a region to reach the economic prosperity that we seek, there are foundational pieces that we have to recognize and we have to address. And this is one key one, and truly commend you and stand behind all your efforts of bringing us together. That's how we'll get to where we need to. So thank you for the opportunity, and look forward to continue learning, but also invite everybody who is watching and listening to join the conversation. There's a role for every single person.
Yeah, that's a great point. But I'd like to just thank you both for joining us on the webinar, being great partners to Thrive West Central. We are here to help collaborate with you all to serve the community in better ways, and we look forward to continued collaboration. Thank you for joining us today.
Thank you.